Hello, everyone. Welcome to my show. Autumn is here. I'm Francine Crawford, your host. And here today, we're going to speak to a nurse that deals with hospice care and palliative care. So we're going to welcome her to the show. Welcome, Nurse Kundan Patel. How are you today?
I'm good. Thank you for having me on your show.
Thank you for participating with Autumn is here. And I know that you work for MJHS. So tell me a little bit about yourself.
I'm a Kundan Patel, nurse team manager with MJHS Hospice and Palliative Care, which is the big organization provides services in New York City. And I've been nurse since 3.5 years as a hospice nurse with the MJHS.
Oh, okay. So can you explain to me there's hospice and there's palliative care? Can you explain a little bit about both of them?
Sure. Hospice care is it's a specialized care for people who are expected to live 6 months or less. So it's like comfort care, focusing main on comfort care and improving quality of life to bring meaning to those final moments. Palliative care is like you are not looking for the curative treatment for your cancer. So you can receive a treatment, cancer chemotherapy, but not the curative, not the research one. And hospice care is more focused on comfort care, who have an advanced disease and would not be cured by any medical intervention.
Okay, so hospice it's not going to be cured. You're making them comfortable.
Hospice care is making them a comfort on those final moments.
Okay. And palliative care is when they have diseases or illness that they may need a lot of attention and medical attention, things like that. So do you sort out what they need? Like sometimes people they take various medications or they need certain things because of how they are inflicted, so the way they live or whatever, or people around them. Do you help them to manage that at all?
Yeah, the hospice care is like care provided to the persons who they are there, like their comfort zone. If it's in a patient's in a home, we provide care home or their familiar surroundings. Okay. So hospice team goes there. We have a team include hospice MD, nurses, trained social workers, pastoral care, spiritual care, bereavement services. Volunteers are there, aides are there. So we collect all resources and provide care where they are to provide them comfort and quality of life, what they have.
So as a nurse, what is your duty in your position?
As a nurse, we focus more on comfort care. So nurse is a main key point with our hospice MD and patient. So nurse generally go 1 to 3 times a patient's home or settings where they are, look at their symptoms, what symptoms they have, and manage symptoms. Like if patients in a not comfort zone, so they communicate with the doctors and make sure persons who is in a hospice, they are in comfort. Collaborate with the doctors regarding any medications needs to be adjusted, or if patients need psychosocial services, communicate with the social workers. If any spiritual or pre-bereavement, if they are thinking they are losing family. So nurse is a key point with the family and our organizations.
Okay, so they work very closely with the family.
Patients and family.
Okay. And can anybody get this service? Like, how do you know that at what point you're going to need palliative care?
Yeah, so I will let families and loved ones knows. Like, if you see your loved ones is deteriorating, like what they used to do and they are not doing now, that's the time you look for consult with your doctor and ask for, palliative care services. So anyone can get palliative care from child to elderly person. So there is no age limit for the palliative care. It's depend on your diagnosis and severity that determined by the doctors. So you need to consult with your doctor, and it's better to start early as possible once you see your loved ones is like declining.
Right. Okay. So your interaction is a lot with the people that are ill and their family. So I'm sure it's a big help to everyone. So what is it that you particularly like about it?
I like about connecting with the patient and family when they really needs it. And when we visit, I know I help them meet someone's needs and brought comfort to them and their family. So they feel taken care of, advocating for patients and their family by using my nursing knowledge to what I can improve to be made them more comfort even end of the life, and helping them when they are more vulnerable at that moment. So nurses, it's like we are there to tell them we are supporting them, give them resources what they need for make them comfort in that journey.
Right. So are there a lot of nurses that go for this, or is it something that is newer to people and less people know about it, so they're not really involved in it? But is it something that's new, or how long has it been going on?
Yeah, so hospice care, it's not that known by the nurses. So we do have a nurses who comes, we got words by words. Like if I used to work in a hospital, so some patients was declining, we refer to the hospice program or palliative program. That's we know. So we have to introduce hospice in the nursing school too. So that's why they know more about hospice care and what care can, what you make impact to those vulnerable people who really need nurses on that end of life journey. Right. So yeah, it's a rare, but community, we are communicating with the community and schools, so that way we can improve knowledge about the hospice nurses.
Oh, that's great. That's great, because if people know about it earlier, then let's know that's a field that you can go into. That's really good. Just a concern, because you've been doing this for a little while, and it's hospice and it's people that are, maybe passing away soon and things like that. How does this affect you if you have, patient after patient that, is maybe passing away and dealing with death? How does that affect you?
I agree totally. So beginning, it's really, when you take care of someone, you go to person's home or any settings. When you go, you build attachment, you build relations. So they feel like, you are family of them. Yeah, it impacts you when they, not here with us. Organization do have a support system. So yeah, we do have a support system every month, every week. So you can join those support groups. So you can talk about your feelings, what you feel. So our organization do have that support group. So nurses or social worker can, join those groups and talk about it. That's where you relieve your emotions.
That's good. That's good, because you get personally involved, with each patient and their family.
Of course, yes.
Yeah. So sometimes that could be very difficult. So, okay. Is there anything that maybe people don't know that should know about this, so they can get help or get services? Is there anything you can tell me from your experience?
Sure. I will let them know. Hospice is mystery for a lot of people. I do understand. I want to let them know, to your viewers know, that hospice is not like, it's you are sending your loved one to the death sentence. It's not that. Hospice care is like give you hope to live better life, better quality of life, what you have left. We build relation with them. So you don't feel you're alone there on your journey, making them right from wrong. Give them resources like we have a specialized social workers, volunteers, aides who can help them out. So those we can provide those cares for family, empower them to make decision for peaceful passing. Hospice care team meet with them and review their life, what they had, and look what we can do to make their visits possible during, living as full as possible every day or moment, what you have remaining, and, provide quality of life with the care, with management. And we are not there to cure symptoms, but we are there to improve your symptoms during your journey. So I want them to know, look at your family, look at your loved ones, and try to collaborate with your doctors and, talk about this. And you can get service as soon as possible and make them more comfortable and memorable journey during end of life.
Okay. Yes. See, people don't know that, so I'm glad that you were able to explain that, because it's something that's really important, and you don't know until you're going through the journey how hard it is. Yeah. And you may think that you are going to get support, for from your family, but it may just be someone else and the medical institutions that can help you. And understand the illness and understand what takes place. So it's really good to have family support, but also some medical help also that understands what you're going through from a medical standpoint and what's going to happen. So that's really good to have and know that you have that service.
Right.
So, but thank you so much. Is there anything else you would like to say to the audience? I appreciate you coming. I appreciate you doing this. And this is so important. This is so important. I want more and more people to know about this, to use this service. So is there anything else that you would like to say to the audience?
I would like to say your audience, don't be afraid to talk with your family, loved ones. You see if they are, advanced in disease, just talk to your doctor, talk to family. And, we do have this service, which is helping you and your loved ones to, make your journey so memorable. And we are there to help you out. So look at those resources.
Yes.
And, make it happen for your loved ones and family.
Thank you. Thank you. So thank you so much for participating in Autumn is Here. We're trying to get as much information out there for people to help them with their loved ones and their aging parents and things like that. Those, it's really tough. And sometimes you don't realize it or think about it until you're in it. And then you're scrambling for information and you may not be able to make the right decisions because, you're not prepared. So Thank you so much. And thank you to MJHS for always supporting Autumn is Here and just giving us the information that you have that's going to help other people. So I really appreciate you for coming out, Nurse Patel.
Thank you for having me. Thanks a lot. Thank you.
All right. Thank you. Good night.